Hi, good evening to everyone. Thank you for joining me. I'm Dr. Philip McMillan, and I've been following the outcomes of the COVID pandemic since 2020. And what I'm discussing today with regards to rapid arterial aging may sound like a strange topic, but believe me, it is one of the most important discussions, and it is very relevant to what we're seeing around us. I just recently did a presentation looking at the statistics in emergency departments in the UK, and it's a stark reminder of how serious it can be when these patterns are occurring across a population and they make people very, very unwell. And so this is pretty important. And therefore, what we will be doing is taking you through the first part of a presentation. As usual, for those people who are with me in the webinar, they will see the full presentation. But if you're just with me on YouTube, as always, I'm happy to engage and keep you updated, but you will only see the first part of this. And so I will start without further ado, sharing with you this presentation from the beginning. So let's get going. COVID's hidden time bomb, rapid arterial aging. The name may sound strange, but it is in fact one of the most important issues that we can be dealing with or addressing at this point. Firstly, with regards to our disclaimer, the information that we're sharing is not to replace you going to your doctor or your emergency department. It is purely for information only. You can use it to help understand the science around COVID-19, but that's as far as we can go. Artery stiffness can predict heart attacks and strokes better than blood pressure alone. And in order to understand why I'm talking about this, you have to take into consideration it was because of a very important paper that was recently put out there. And in that paper, they were highlighting something that struck me, and they were talking about accelerated arterial aging after COVID-19 infection. And it caught my attention because whenever I see a study like that, I want to understand what does it mean in terms of the cohort, whether or not they were looking at vaccination as well. Whenever I ask that question, you can imagine it causes a lot of consternation. People get very upset, but it's an important part of the science. The reason I ended up talking about this was because there was a small bit in that paper that, in my view, highlighted the most important question that we needed to answer. And when they looked at the cohorts, they had them broken down quite nicely. And this is what we will discuss in a little more detail in the paper. But they had the COVID negative, COVID positive, non hospitalized, COVID positive, hospitalized, and COVID ICU. And they were measuring pulse wave velocity, which we will talk about in a second. But the reason I focused on this was because of the COVID negative cohort having the highest rise in terms of pulse wave velocity. I wanted to understand if they didn't have COVID, why would this rise? And if it is rising and they were vaccinated, was this the cause? And this is what led me to do the research, looking at what this means in the context of the current predicament we face from a health point of view. So here is what we'll be covering in this time. We'll do an overview of pulse wave velocity and the link to arterial stiffness. We want to understand the role of vasovasorum in arterial inflammation. We want to also understand how spike protein inflammation mechanisms leads to stiffness and potentially what can be done to try and address this. And this is the aim that I'll be trying to do, to look at it and try and understand, if we understand the science, what can be done about it. As usual, let's start with the center of things. Spike protein. This paper, the persistence of spike protein at the skull meninges brain axis, is critical. I can't emphasize how important the study is, because what they did is they looked at what happened with mice after infection, and you can see there there is a little smattering outside of the lungs of the spike protein. But they were interested in, this is influenza here, primarily in the lungs. But what happens to the spike protein if it's injected? Where does it bind to? And my goodness gracious, when they did that, the body lit up. Now, there's an important thing here that I'll be coming to in a second. You can see the kidneys here, the heart here, the brain here. This is absolutely critical information, because in some people, spike protein continues to circulate. Now, we can argue where its source is from, but that can sometimes cause issues with regards to the science. But let's just focus on just the spike protein, whatever the source. Now, what I want you to understand is the characteristics of arteries in terms of the differences with pulse wave velocity. Here you have an image of someone, and this is a heart. And you can then see the arteries going to the brain, to the arms. Then going down is the abdominal aorta, splitting into the iliac arteries, down into the femorals to carry blood supply around. What you have to understand is the big arteries here, all the way down, these big ones, tend to be elastic. And they have inside the tunica media, that's the muscle layer of it, elastic in it to make it stretch. The tunica intima, the inside, has the lining of the blood vessel, and the outside here is very important for these large arteries, and I'll explain why, the externa. But as you go down in terms of size and you get to the smaller arterioles, you can see that the muscle layer is much thinner, and down to the capillary, it's just very thin. The reason I'm highlighting this is because for these big arteries, they need extra blood supply, not just from the inside, but from the outside. And that's where the focus is going to be in terms of this study. And this is why I'm highlighting to you those big arteries, because as I've got the mouse here that was injected with the spike protein, what I want you to notice is outside of the organs that are affected in terms of the concentration and the binding of the spike protein, if you look carefully, as you remember the abdomen, most of the concentration of the spike is in these large arteries, okay? This is very important to observe. As you go down into the limbs, if it's just binding to the artery itself, it should be uniformly distributed all the way through. It's not really in the distal parts of the limbs. It's not to the skin and so on. It's not. It is mainly in the center. And as I said, that's where the large arteries are located. And so this is then very important. Now, what happens to these arteries in terms of aging? Why do they age? You have to remember that the healthy arteries, they are elastic, and so they absorb each heartbeat. Every time your heart pumps, they kind of stretch and they absorb some of the pressure so that it controls the amount and the force of the pressure going down to the rest of the body. But as you get older, and if there's any damage to these arteries, the elastin or the elastic breaks down. Then you have deposition of collagen, which makes it stiffer, and therefore the blood pressure gets higher. And it's largely because the arteries are just not as elastic. And that's very important because, as we know, hypertension is a critical factor in relation to many chronic diseases. Here's a closer look at this artery, these big arteries, and you can see it now broken down into the layers. And as I said, on the inside is the endothelium, very smooth, and then you have this muscle layer. But this yellow part here, running around it, just around the inside and the outside, is the elastic. And this is what gets damaged as you get older. But the part that we're going to be focused on very much is what we call these vasa vasorum, the blood supply to the outside and down into the middle of these big arteries. The reason that this is so important is that vasa vasorum are not everywhere. They are only largely on big arteries and arteries to many of the major organs like the kidney and the heart. And that could explain why the spike protein was binding primarily in this part, not necessarily the lining of the arteries, but actually on the outside, the vasa vasorum is where the inflammation exists. And this is something I'll be showing later on when I look at the papers, because I'll be showing what is likely to be where the main inflammatory process is around longer term issues with COVID or spike protein exposure, to be more accurate. When we think of the pulse wave, so every time your heart beats, there is pressure that increases and then it comes down. It's like what we call the systolic and diastolic measurement in the blood pressure. And so the pulse wave velocity is measuring how fast the blood pressure wave goes between the carotid and the femoral arteries. And there's literally a measurement with a specific ultrasound looking at the difference to work out whether or not the pulse wave velocity has increased. If it's faster, it means the arteries are stiffer. And it is the gold standard marker of vascular aging. And so this was why this paper was so important. Stiff arteries means that there is less elastic, it doesn't expand as much, so the pulse wave goes faster and the pressure becomes higher. And this is therefore what is so significant. And as you have higher pulse waves and higher pressures, you're also more likely to damage the lining of these blood vessels. And it's important to note that the lining, although it's smooth, it also has this thing we call a glycocalyx. It's like a surface covering, like a very thin, furry surface covering, and this protects the cells, the endothelial cells just underneath. If this gets damaged, this is where we then start to see the buildup of plaque disease underneath, which again contributes to much of the damage that we see certainly in the heart and otherwise. So why is it so important and how is it associated with risk? Well, for each meter per second that the pulse wave, approximately 15% of the cardiovascular risk. This is a predictor for heart attacks, strokes, dementia, kidney disease, and the wider these pulse waves and the higher the peak is, that's the peak blood pressure, will determine how significant that cardiovascular risk or cardiometabolic risk is. So these are very, very important issues. And one of the ways simply that you will be able to know about this is because of your blood pressure. This is why I emphasize to people that your blood pressure is your responsibility. It's not your doctor's responsibility. He will help to manage it, but you need to know what it is. Everybody can do their blood pressure. And so, therefore, everybody is responsible to know what that is. And your blood pressure is simply measuring the pulse wave as it passes through the upper forearm, this region of the body. And it's critical to understand what that is because as you have the aging, as you have the hypertension, as I said before, the complications are heart, kidney, peripheral vascular disease, retinopathy with the eye, stroke disease. These are the major complications. And this is why I think that as we continue through the ongoing circulation of the virus, the ongoing exposure to spike protein, this pattern is going to gradually increase and carry with it all of the implications of serious long-term health issues. This is why the hospitals are full. This is why they are not going to get any better year on year. I can predict that. I predicted it 3 years ago. And I will tell you, year on year, if we don't find a way to address this, it is going to reach a point where it is completely unsustainable if it is not already there. Just a reminder about your blood pressure. You want it less than 120/80. And what you will find is that as your pulse wave velocity increases, the systolic may go up significantly higher than the diastolic. So your blood pressure may be 180/80. And that is a good indicator of pulse wave velocity and increased stiffness. All of this, though, is critical for everybody to be aware of. As I said, so few people are making reference to this that I am educating you as to how to take care of your health. Blood pressure is an absolute essential in terms of protecting your health. Here we have an image with regards to a healthy artery. This one has lots of elastic in it, not yet damaged. This is what it looks like. The artery wall is nice and clean. But then in coronary artery disease, that's heart disease, or peripheral vascular disease, because of the pressure and the damage, you then have buildup of plaque inside, cutting the amount of flow in half. And what happens is as the pressure increases to go through this, it does more damage to the surrounding blood vessel. This is the driver for many of the conditions that are making people unwell at the moment. And a lot of it is because of damage to the lining of these arteries. Just remember, when we talk about these muscular arteries, the part that I'll be focused on is the stiffness that is occurring in the tunica media of the big elastic arteries, the aorta, the iliac arteries, the carotid arteries. As they get stiffer, the pressure wave increases and makes it more likely that people are going to have severe disease. The point that I'll be showing you here is that, in my view, the primary pathology is occurring in the big arteries in relation to the vasa vasorum lining these big arteries, causing inflammation and leading to stiffness in these arteries. Less affected are some of the smaller ones, but sadly, because the pressures will increase in the big arteries, it will then have a knock-on effect to all the other arteries around. So, as we said, artery stiffness can predict heart attacks and strokes better than blood pressure alone. You have control over your blood pressure. I would advise that this is something that you need to make sure is well addressed. Thank you very much. And for those people who are with me on YouTube, great to have you here. And we'll look out for the full presentation. For those people who are registered for the webinar, we will continue in just a moment, just after this outro.